anyone who suffers from acid reflux or GERD hates the burning pain in their chest and the regurgitation of bitter acid into their throat when they bend over or lay down. But worse than that is the frustration and anxiety from the inability to eat any meal comfortably without suffering through the pain. As a result, 50 million Americans take both prescription and over-the-counter heartburn medications like Prilosec, Nexium, and Prevacid. So what the heck does any of this have to do with peripheral neuropathy? Well, research has revealed that long-term use of these heartburn drugs causes significant damage to your peripheral nerves. In part 1 of today's video, I'll reveal how these seemingly innocent medications are wreaking havoc with your health and your nervous system. And make sure you stick around to the end of the video, because in part 2, I'll share how you can stop heartburn naturally so you're not dependent on these medications. You don't want to miss any of this. Coming up. Hey gang, Dr. Valerie Montero here. If you're finally ready to conquer your neuropathy, reclaim your life, and start living again, then subscribe to our channel and don't forget to click on the bell so you're notified as soon as we publish new content. Now let's dive into today's video. More than 60 million Americans experience heartburn at least once a month, and some studies show that more than 15 million Americans experience heartburn symptoms every day. But there's a bit of confusion between the difference of heartburn versus GERD, or gastroesophageal reflux disorder. So let's clear this up. Acid reflux is when a person experiences backflow of stomach acids into the esophagus, and this occurs with both heartburn and GERD. The difference between the two is that with heartburn, the regurgitation is less frequent. It will only occur about once a week, or even less than that. However, with GERD, the regurgitation will happen several times a week or even daily. Long-term GERD has serious health repercussions. It can cause esophagitis or chronic inflammation of the esophagus, ulcers or bleeding in the esophagus, and it can also lead to a condition called Barrett's esophagus, where the scar tissue will begin to build up and cause a narrowing or a stricture in the esophagus. Worst of all, GERD can lead to esophageal cancer. Now, the most common way acid reflux is treated is with the use of medications called proton pump inhibitors, or PPIs for short. These go by the names of Nexium, Prilosec, Prevacid, and Acifex. There are several more PPIs on the market, but these are the most commonly used. Proton pump inhibitors are commonly used to treat heartburn, GERD, ulcers, and H. pylori, which takes us to part 1, how proton pump inhibitors wreak havoc with your overall health and your nervous system. First, let's talk about the way a PPI works. The function is to limit the amount of acid produced in the stomach. It's important to realize that it hasn't fixed the problem that caused the backwash in the first place. This medication is merely placing a Band-Aid on the situation. In other words, it's only addressing the symptoms temporarily. Most people don't realize the FDA mandated that these medications should never be used for longer than a 2-week period. And it even states that on the box when you purchase this. This is because of the tremendous side effects caused with the long-term use of proton pump inhibitors. However, in our grossly over-medicated society, doctors prescribe these meds for years on end, and pharmaceutical companies have even made them available over the counter. Isn't that nice of them? So, what's the problem with taking PPIs long-term anyway? First of all, these medications lead to a vitamin B12 deficiency, resulting in damage to both the sensory and motor portions of the peripheral nerves. And it also causes demyelination of these nerves. Remember, the myelin sheath is the protective coating around the nerves, and it plays a huge role in the signal transmission along the nerves. Secondly, proton pump inhibitors also lead to magnesium depletion. Without magnesium in the picture, too much calcium moves into the nerve, resulting in severe overstimulation of the nerves called excitotoxicity. This can lead to nerve cell death, resulting in severely damaged peripheral nerves. Magnesium and B12 both play a critical role in the central nervous system made up of your brain and spinal cord, as well as in your peripheral nerve function. With a vitamin B12 deficiency and damage to the myelin sheath of the peripheral nerve, you set the stage for a very severe case of peripheral neuropathy. Since both sensory or small fiber neuropathy and motor nerves or large fiber neuropathy can get damaged, a person can experience a combination of symptoms, including prickling and tingling sensations, pins and needles, numbness, burning or sharp pain, inability to feel cold or heat, loss of balance, muscle spasms, cramping or twitching muscles, muscle weakness, and muscle atrophy. There have also been numerous research studies showing a direct link between taking PPIs and developing cognitive memory impairment leading to Alzheimer's disease. This again is due to the demyelination or the breakdown of the myelin sheath in the brain. Studies further show that acid reflux medications damage endothelial cells. These are the cells that line the blood vessels, allowing the exchange of oxygen from the blood into tissues. Once these cells are damaged, it's very difficult for oxygen to transfer from the blood into the nerve cells. This microvascular damage can cause peripheral neuropathy. Now, I have to tell you, I wish the fallout from taking proton pump inhibitor medications ended here, but it doesn't. Besides being linked with Alzheimer's, dementia, they're also linked with increasing a person's risk of developing pneumonia. Wait, it still doesn't end here. Research has further shown that taking PPIs long-term can result in kidney disease and can decrease bone mineral density, resulting in hip or bone fractures. In fact, in 2010, the FDA revised the labeling of these meds to include a warning about the possibility of increased bone fractures with their use. One last thing that I'll mention is that these acid reflux medications have also been linked with raising the risk of stroke. Now, I want you to know these aren't the only serious ramifications of taking these medications. I didn't list all of them to avoid turning this into a 30-minute talk, but just know there are many more consequences to the long-term use of PPIs. This drug suddenly doesn't sound very innocent anymore, does it? Well, here's another scary fact. Did you know that acid reflux is very common in babies? About half of all babies spit up many times a day for the first 3 months of their lives. Doctors are now prescribing the generic forms of these proton pump inhibitors for infants. Guys, whether it's a brand name like Nexium and Prilosec or it's the generic, the side effects are still the same. So we're now dooming our infant children to a lifetime of sickness and illness. Now, the good news is that it's so easy to correct acid reflux in infants. In fact, one of my patients had a grandchild who was 1 month old and had acid reflux so severely, this poor baby would projectile vomit anytime he was fed breast milk or formula. The pediatrician placed this baby on omeprazole, and this is the generic form of Prilosec. Of course, his grandmother was concerned because she didn't like the fact that her 1 month old grandchild was on medication. And she was smart enough to realize that the medication wasn't fixing the problem. So she made an appointment, and along with her daughter, they brought in this beautiful baby boy. Well, to make a long story short, we had his gut healed over in 30 days. No more spitting up, no more crying and screaming in pain anytime he drank, and no more projectile vomiting. So stick with me until the end because I'll share with you the simple, easy steps I took to fix this baby's gut. Right now, let's go over some of the causes of acid reflux. Can you guess what the biggest culprit is? If you guess diet, bam, you nailed it. An unhealthy diet laden with processed foods will land you on GERD lane, where you can take up residence for the rest of your life. Don't worry, I won't let that happen to you, but you do have to take some responsibility by cleaning up your diet. At the bare minimum, you should start by cleaning out some of the main food triggers like tomato sauces, chocolate, oranges and orange juice, caffeinated beverages, carbonated beverages, processed meats like sausage and even bacon, spicy foods, artificial sweeteners, vegetable or canola oils, alcohol, and smoking. Now, this is a short list for you to start with. Ultimately, if you want to get the fastest healing of your GERD, follow an anti-inflammatory diet for at least 30 days. I also want you to be aware that certain medications can cause acid reflux, such as frequent use of antibiotics, osteoporosis medications known as bisphosphonates like Fosamax, Boniva, or Actonel, pain reliever meds like ibuprofen and aspirin, sedatives and tranquilizers including Valium and diazepam, and calcium channel blocker meds for high blood pressure. Remember, I mentioned in my video, Medications and Peripheral Neuropathy, how this class of antihypertensives is directly related to damaging peripheral nerves. Other things that can lead to GERD are hiatal hernias, pregnancy, chronic inflammation, and mental or emotional stress. Now, let's talk about what the symptoms look like. Most people are aware of the common symptoms, including burning pain behind your breastbone and regurgitation of food, especially acidic foods. But there are other symptoms that aren't commonly known, and they include a bitter taste in your mouth, waking up in the middle of the night choking or coughing, dry mouth, bad breath, bloating after meals, nausea, belching, including gas production and burping after meals, hiccups that are difficult to stop, discomfort when bending over or lying down, or acid regurgitation into the throat with these movements, hoarseness when you wake up or throughout the day, and chronic throat irritation, soreness, or dryness. Okay, how about we get to the exciting part of what you can do to heal your gut so you don't have to take these nasty medications and open yourself up to even more serious problems. Part 2, how to stop heartburn naturally and heal your gut. Now, before I dive into this section, I do want you to know that if you've been taking Nexium, Prilosec, Prevacid, or any of the generic forms for a long time, you can't just stop taking them cold turkey. They will cause a violent reactive backlash if you do. So it's important to wean yourself off of them slowly. Now, besides making dietary changes, there are other things you need to do to heal your gut. First, start by taking a good quality digestive enzyme. This will help you fully digest your food and allow nutrients to absorb quickly so that the food doesn't sit in your stomach too long. Here's an important side note, guys. If you take a digestive enzyme and it flares up your symptoms, that's an indication that you have a significant amount of damage from acid reflux. In this case, you want to start with an ultra gentle digestive enzyme, like one that's called Digestyme by Transformation Enzyme Company. Then you need to begin repairing the stomach lining. So the way that I address this with my patients is by placing them on a supplement called Gastrovin by Premier Research Labs. If your acid reflux is severe or daily, you'll want to stay on this formula for about 2 months. Otherwise, 30 days usually does the trick. After this, I then switch them to a formula called GI Integrity by Pure Encapsulations. And then I can place them back on the stronger digestive enzyme, which everyone needs. Next, incorporate probiotics into your regimen. Now, because there are so many varying strains, not all probiotics are the same. So to tackle GERD or heartburn, you want to make sure your probiotics include the following strains that I've listed on the screen. I'll include links below to quality companies that carry these strains. I recommend staying on probiotics for about 4 months. After that, get your probiotics naturally from your diet by eating fermented vegetables like sauerkraut or kimchi, which is a fermented cabbage dish. Dr. C makes an amazing kimchi. Also, add kefir into your diet, but make sure the kefir is made from whole milk and there are no added sugars or preservatives. Next, drink organic chamomile or ginger tea. This reduces inflammation in the digestive tract. It's even better when you make the fresh ginger tea yourself, and it's super simple. Simply grate fresh ginger, or you can even slice it up, and boil about a 1-inch piece in water for about 20 minutes. Add in some Manuka honey, and you have a great healing agent. Also, you want to take about 200 milligrams twice a day of magnesium. Lastly, I'm not going to let you forget, change your diet and incorporate intermittent fasting. So once you conquer this bout, it doesn't come back again. Okay, before I end things, I promised I would tell you what I did for that beautiful baby boy, whose name, by the way, is Thomas. Thomas's mom was feeding him both breast milk and formula because she was having a great deal of difficulty producing enough breast milk, so she had to end up supplementing him with quite a bit of formula. So what I did was I changed his formula from a standard commercial-based formula to a goat milk-based formula. Now, this is far less inflammatory for the GI tract. I also had her pump her breast milk so that whenever she fed him, she could easily add in the digestive enzymes, whether it was to her breast milk or the formula. So for the digestive enzymes, I had her use Digestzyme by Transformation Enzymes Company. I also placed Thomas on a powdered supplement called colostrum and a probiotic. All of these things were added to his bottle of either breast milk or goat milk formula. Lastly, I had his mom apply a castor oil pack to his stomach every day. Now, this approach works like a charm every time. And those of you who have children know there is nothing worse than watching your beautiful infant suffer with pain and not be able to eat. Well, gang, that's a lot for today, and that just about covers everything. You have enough information to heal your gut and get off of those PPI meds before you become a medical statistic. Healing your heartburn or your GERD can be a huge game changer in your life, not just for your peripheral neuropathy, but for protecting yourself against things like Alzheimer's, cancer, and all of the other problems associated with proton pump inhibitor medications. I sincerely hope you use this information to reclaim back all parts of your health. If you're enjoying our videos, please don't forget to like us and click on the bell to get notified as soon as we release new videos. Until next time, my friends, I look forward to seeing you on the road to great nerve health. Blessings. I also want you to be aware that certain medications can cause acid reflux, such as frequent use of